Also in the room are the other members of the EXECOM who are here with us today as well to be able to provide some inputs as well sa mga tanong po ninyo. Let us start with the statement coming from our Secretary of Health, Secretary Francisco Tito III.
Yes, once again, thank you very much, ASEC Lyndon, and in behalf of the Department of Health, I'd like to greet all of you a most pleasant morning to our friends from the media, as well as to all of our viewers and the Filipino public. Today, I am announcing that the Department of Health is partnering with the University of the Philippines, Philippine General Hospital, or UPPGH, to independently review and validate all alleged deaths following Dengvaxia vaccination in order to promote fairness and transparency. We are being transparent to erase doubts of some sectors and the public that the DOH is allegedly concealing material information resulting from Dengvaxia vaccination. The UPPGH, as the National State University Hospital, is the most credible third-party institution to conduct this review for the DOH, as it has the clinical and research expertise, as well as the mandate to provide assistance on matters of important national health concerns. UPPGH will be providing an independent review and assessment on the probable cause of deaths of cases submitted by the DOH through an expert group of pediatric infectious disease experts, together with some forensic pathologists and other specialists with no financial or intellectual ties to Sanofi Pasteur. I also reiterate that the DOH welcomes any inquiry and has in fact been cooperating with authorities on the investigation on Dengvaxia procurement and alleged deaths due to Dengvaxia vaccination. The DOH continues to consolidate all relevant documents requested by the National Bureau of Investigation upon the orders of the Department of Justice to look into the procurement and administration of the dengue vaccine on more than 830,000 Filipino children. The DOH commits to fully cooperate in the conduct of the investigation on the issue and has in fact already submitted relevant documents to the Senate and Congress last year, even before the recent announcement of Sanofi Pasteur that the dengue vaccine poses risks on individuals with no prior dengue infection, where the vaccine should no longer be administered. Meanwhile, the DOH will be instituting a more permanent scheme of monitoring all cases in the coming years through its recently created Dengue Vaccine Task Force. The DOH has already constituted an independent expert panel of top scientists from relevant professional fields to examine new evidence on Dengvaxia and formulate specific technical guidelines on enhancing adverse event following immunization, surveillance, and monitoring. The safe administration of the dengue vaccine, case identification, and management, and setting up efficient hospital referral systems. The DOH expert panel is set to convene for the first time next week. We assure the public that our public hospitals are prepared to handle and manage severe dengue and other potential adverse events following immunization. We have long instituted the dengue fast lanes in our DOH hospitals. DOH has also set up 24/7 hotlines on the dengue vaccine, apart from creating dengue public assistance desks, or DPAD, in the DOH central office and its regional offices in regions 3, 4A, NCR, and Cebu in Region 7 to respond to the questions and concerns of the public regarding the dengue vaccine. To date, so far, we have had 700 calls or inquiries regarding the Dengvaxia vaccination. We have also begun conducting orientations among schools and local government units, which were covered by the dengue vaccination initiative through our regional health offices. Apart from this, we have also started holding the series of stakeholder meetings since yesterday, December 20, that is, attended by the concerned government agencies such as the DepEd, the Department of Interior and Local Government, the DSWD, and the Council for the Welfare of Children, as well as accredited relevant professional medical societies and associations. We reiterate our call to the parents and caregivers of the vaccinated children, monitor their health as well. At the early signs of dengue, I would like to reiterate that they please bring them to the nearest health facility so that they can be properly managed and further complications avoided. So this is the first of the two press releases from the DOH. Should I now segue?
Later, probably.
Later.
For the train law.
Would like to first, the next one is the press release on the passage of the train law. But in the meantime, we would be welcome to answer your question.
Okay. I'd just like to inform the group as well that joining Secretary Duque are the different chairmen of the different committees of the task force now looking into the Dengvaxia concerns. Yes, we're now opening the floor. Please introduce yourself and the media that you're presenting. And
part of the heightened surveillance and monitoring is really all the students have to be monitored, because remember, you cannot differentiate which among these students have had prior dengue infection, in which case if they had, the vaccine continues to provide protection, but of course not 100% protection. It's the problematic cases would be those who never had a prior infection with the wild dengue virus, had been vaccinated, and had been once again bitten by a mosquito that carries the dengue virus. So now we're monitoring. We have alleged deaths. No, I understand one from East Avenue Medical Center, but we need to get and consolidate all of the clinical chart, the documents inside the clinical chart. No? And that's why we said UPPGH experts will be the third-party review body to exactly find out what were the circumstances attendant to the alleged death due to the Dengvaxia. Please. Well, I think I will have to. Bobot might have a list. Yusek Bobot.
Just to give you a sort of a general picture, no? As of December 19, 2017, the EB or Epidemiology Bureau has received a total of 133 vaccinees reported na hospital. Out of these 133, 36 were due to dengue. So vaccines ito, but it didn't say kung ilan yung serious, ilan yung severe, no? But ito ang ating report from EB Bureau. So to that particular question, is this the one that was reported by the mayor na hindi pumapasok because of that? So, ang ano dyan, bottom line, these are just, I think these patients were not hospitalized. So we don't have hospital information on this, but our regional director is already following the case. Wala namang adverse talagang effect. So it might be dengue. We're trying to validate that information. Although that's the one that was mentioned by the mayor sa Mabalacat, and there were no other cases. That was about maybe over a week ago already. And the hospitalized lang po ito.
Okay, thank you, Yusek Valle.
Let me
Yes,
just
sir.
add to that. The DOH, as part of its heightened surveillance and monitoring system that we have already put in place, there is a very important factor inherent to this heightened surveillance, which is the National Adverse Events Following Immunization, NIFI. Okay, so that unit of the system or of the DOH is tasked precisely to monitor all adverse events following Dengvaxia immunization.
Okay, thank you, sir. Ms. Tina?
Hi, Tina.
Well, we're going to refer probably 2 to 3 cases. We're just collating all of the data now, and we've already agreed that they will create the task force and identify the specialists. Iba-iba kasi depende sa ibang sakit ng bata, no? For example, the SLE case, they will have a rheumatologist with the infectious disease, and yung namang may cardiac would be a pediatric cardiologist. So once we have this, I think we're thinking now of 3 cases that we might be referring for review, for the clinical side, and if needed, we also have 2 forensic pathologists in PGH who will be working with us. Once we submit it to them, they will be able to give it to us within 2 weeks. Their independent review.
Okay. Thank you, Yusek Domingo. Any other question from our media group? No more question?
Yeah, why don't you?
Yeah. I think it will really be mostly clinical, especially for the post-mortem examinations. It will be looking at the laboratory exams and the physical examination of the child. The advantage of having PGH do it is they're going to have multi-specialists and people who are the best in their fields. So pag may confounding na ibang illnesses, these specialists will be able to say if the symptoms or the findings and the laboratory examinations are consistent with dengue or something else. Of course, the other thing would be an actual autopsy or a forensic pathology review of the mortality. But it's going to be basically history and laboratory exams. And they're also trying to trace sa laboratory if in the labs that the patients were admitted, if they have blood samples of the patients that we can do further testing on.
Okay. Thank you, Yusek Domingo. Any other question? Last natin yan. May isa pa kasi tayong agenda. Okay. Hindi na. Pupuntahan natin yun. Okay, so with that, we go to the next agenda. So we would like to thank our USEC who joined Secretary Duque in the table. May we welcome now USEC David to please join Secretary Duque as we open our next topic. Okay, our next topic is really on the passage of the train law. So may we hear from Secretary Duque?
Okay. The DOH commends the passage of the law on tax reform for acceleration and inclusion, more commonly referred to as the TRAIN law, recently signed by President Rodrigo Roa Duterte. The TRAIN law provides for an increase in taxes for cigarettes and sugar-sweetened beverages that will support the DOH programs on the promotion of healthy lifestyles and the prevention and control of non-communicable diseases, or NCDs. The law also supports the initiatives of the DOH on lowering the prices of medicines by exempting from the 12% VAT all medicines used for diabetes, high cholesterol, and hypertension. The DOH will be monitoring drug prices to ensure that VAT exemption on medicines will redound to more affordable prices to consumers. The World Health Organization also lauded the Philippines for being the first country in Asia to introduce such a landmark tax measure which imposes a tax of 6 pesos or 12 pesos per liter on all sweetened beverages, depending on the type of sweetener used. With millions of Filipinos who have become overweight and obese, and with diabetes now afflicting millions more of our countrymen, we support a higher pricing policy for less healthy food and beverages as part of a multi-pronged strategy to combat non-communicable diseases. The additional resources generated by this measure can be utilized in subsidizing the national government's healthcare reform agenda of providing universal healthcare to Filipinos. Revenues earned from the tax reform can be used to fund more benefits for PhilHealth, specifically in addressing the costly and harmful consequences of consuming sugar-sweetened beverages, which have constituted a major expenditure for PhilHealth over the past decade. This includes obesity-related diseases, as well as diabetes and its complications, such as stroke, heart attacks, and end-stage renal failure, which are now significant contributors to the overall burden of premature deaths and disability in the Philippines. This action by the Philippine government concurs with the World Health Organization's call for member states to, and I quote, make use of taxation measures raising by at least 20% the retail price of sugary drinks to influence the purchasing and dietary choices of their populations, end of quote, as mentioned in the official WHO report issued in October 2016. For greater impact, we also recommend that the government complements the tax measure with other regulatory and policy instruments to reduce access to unhealthy food and encourage healthier diets among our people. This includes educational campaigns, informative food labeling, and subsidies for healthy food such as vegetables and fresh fruits among the economically disadvantaged. I reiterate that we thank the President and both houses of Congress for prioritizing this vital tax measure, which boosts the DOH campaign for healthy lifestyles. The TRAIN law is a welcome gift of President Duterte for the Filipino people. Thank you. Questions, please.
Thank you very much, Secretary Duque. We now open the floor for any question or clarification of the TRAIN law.
This is by January of 2018. Yes. Well, we're working on it. That much I can say. We've written the president with regard to that, and we'll just have to await what the office of the president will say with regard to our take on the issue. That maliit nga.
But do you think, sir, follow up? But do you think, sir, yung package yung small interest rate would adversely affect yung ibang pending proposals in the Senate or a higher rate?
Well, we hope not, but let's not preempt what the office of the president will finally decide, because there are many, the president has the power to veto certain line items of the law. So I do not want to preempt nor second guess the president with regard to this. But rest assured that we have given our recommendation, and I would leave it at that. Until we hear from them, there's not much I can say. David would respond.
Yes, for the train, the earmarking is 70% allocation for the build program of the government, and 30% for all social sector projects, including also the self-reliance of sugar farmers. We would have hope for a direct earmarking like the syntax for the revenues directly for nutrition and health, but for now we will be included in the 30% allocation earmarking for the social sector. Well, this is a general rule anyway, na 30% earmarking for the social sector, and the health is included there.
Thank you, Yusek David. Okay, may tanong pa po. Okay, so we close out the topic on the train law. Maki was raising her hand a while ago regarding other concerns. Yusek Jerry Bayugo, can you join our secretary dito po sa table? So Maki?
Yeah, what's the question? Sorry, Maki. Yes, December 21. So what are the numbers or data? Yeah. Wala pa. Mag-uumpisa pa lang. It's premature. The report will be tomorrow. They will come in. The monitoring has been in place anyway. Boring. Yeah.
Sige, habang nag-iisip si Maki, I saw Cory raising her hand. Cory?
That was last night. Or it should already be included in the report that will be submitted tomorrow morning. Tama ba?
Thank you, sir. Actually, we start active reporting starting incidents that are received today. So yung mga nagpakonsulta, simula sa araw na ito, yun yung ating binibilang. So if it happened last week, hindi pa siya kasama doon sa nire-report natin. Bakit? Kasi we would like also to establish that trend every year. Kasi kung iba-iba yung ating timeline, hindi magiging comparable yung ating ipipresent na information. So gusto natin makita bumababa, tumataas. Kung tumataas, ano pa yung dapat gawin, ano yung problema. Kung bumababa, then probably it's a good thing that our advocacy, the media's help is doing good para ma-prevent pa yung injury sa ating mga kababayan. So that's why we, since more than 10 years ago, we started collecting from December 21 until January 5. So the report, the incidents that will be reported today, we will consolidate it tomorrow morning. So bukas pa malalaman kung may mga injuries na nangyari o nagpatingin sa ating mga sentinel sites. Ang nakita nating significant reduction or significant less injuries, itong nakaraang taon, last year, it became 630 from 922 that we have recorded the other year. The other low figure was in 2007 yata. I think the Secretary Duque was still the secretary that time. 700 plus. That's the second to the lowest compared to what was seen last year.
Community-based fireworks. Pero, ano ba yung ilaw? Pyrotechnic lang. Yeah, oo. So, siguro bababa pa ito lalo. No, I'm not. It's just that we need to monitor the implementation of the EO 28. And there, what is being encouraged is actually a community, a public display of fireworks, which is safe, and this is handled or conducted by experts from the PNP. So making sure that this will add to the desired reduction in the number of casualties. Yes, but yeah, that would be ideal. Yes, I think so. There will still be, but it's not the issue of whether there will be injuries or not. The issue is how much less will it be compared to 2016. So that's what we ought to be looking for. But if I had my way, I would really ban all of this completely, because as a Secretary of Health, we make sure that nothing comes in harm's way of our people. So, but the reality is that there are still, certain sectors or quarters who may not be ready to completely forgo this, with this industry. So we hope to be able to do a more strategic long-term plan for them, because you just can't take away that industry overnight. So we need to prepare them to have alternative livelihood programs. So we will sit down and do the planning after consultation with the concerned stakeholders.
Okay, thank you, Secretary. Any other question?
I hope that doesn't make it any less boring. Maki.
That's the cases dapat hindi boring. Okay. With that, we will hear the last question.
Yeah. Well, do we have anything for them for Christmas, like lunch? Do we have lunch for them? Oh, you better make sure that there's lunch for each one of them. Okay. Yeah, I would like to invite all of you on December 31 at about 4 o'clock. Please join me as I do my rounds of the hospitals and to assess the level of preparedness. That's going to be 3 hospitals, Jose Reyes, the Orthopedic Center in Banaue, and East Avenue Medical Center. And then after that, we will have the next reporting close out January 6 in the morning. Okay? No January 1. Oh, because I was, unless you convince us that there should be January 1. The problem with January 1 is, it's a very partial report. The January 6 is a close-out report. And to me, that might be better. Because what oftentimes gives rise to some confusion is the public says, oh, January 1, ganito. Oh, but January 6, ganito ang naging. So, parang ang gulo-gulo. So, sabihin na lang namin, isa na lang, close-out report. But feel free to convince us today. Kasi wala kayong balita. 4 p.m. here. Oo, wala kayong ibabalita. Ha? Pero, marami naman yan dahil, syempre, sa mga ospital, sa mga kung saan-saan. Oh. Ano? Immediate na bagsak. So, gusto niyo alauna ng January 1 tayo magkita? Ha? Huwag naman umaga. Hapon na nga. Anong oras niyo gusto? Sige, anong oras niyo gusto? Ha? Ay, bakit lumalapit sa tanghali? Baka ibig mo sabihin, alauna, matapos ang tanghali. Oh, 1 o'clock? Sino taas ang kamay? 1 o'clock? Hapon, ha? Hapon. Oo. Gusto nyo, pwede, umaga, 1. Mag-isa lang kayo. Sige. Okay, so, 1 o'clock. 10 a.m. na umaga, taas ang kamay. Isa lang. Okay, mag-iisa ka. Pero hindi ka nag-iisa, sasamahan kita. Sige. Okay, so January 1, we meet. 1 o'clock. 1-1. Okay. December 31, 4 p.m. here at the DOH. Thank you.